Welcome to the Deep Dive, where we cut through the noise and give you the essential insights you need to be truly well-informed. Today, we're diving deep into the fascinating and, well, often hidden world of abnormal heart rhythms in horses, specifically those that pop up or get worse when a horse is exercising. We call them equine exercise-associated arrhythmias.
Yeah, it's a really critical area in veterinary sports medicine. These arrhythmias, they can severely impact a horse's performance, sometimes lead to serious issues like sudden collapse. They're definitely something every horse owner or professional, needs to understand.
And you've given us some incredibly detailed material for this deep dive, including a specialist-level study guide. Our mission today is to pull out the most important, maybe surprising, and actionable knowledge from these pages. We want to help you grasp not just what these arrhythmias are, but really why they matter so much to a horse's health, safety, and their athletic career. Get ready for some serious insights.
Okay, let's unpack this right away. What exactly are exercise-associated arrhythmias, or EAAs? Simply put, they are abnormal heart rhythms that either appear for the first time or get significantly worse when a horse is physically exerting itself. Now, these can range from totally harmless, normal responses to exercise, all the way to potentially life-threatening conditions. Their impact can be huge. Think poor performance, a horse that just can't keep up, maybe stumbling or even collapsing, which we call syncope. In the most severe cases, it can sadly lead to sudden cardiac death. So that's why early and accurate diagnosis is just absolutely critical.
And it's interesting because while we often think of these in like high-level athletic or performance horses, they can actually affect horses at lower levels of activity too, right?
That's right, yeah. And to truly understand what's abnormal, we first need to appreciate what's normal for a horse's heart during exercise. A horse's heart rate, it can skyrocket from a resting rate of, say, 28, 44 beats per minute all the way up to 240 beats per minute in a fit athlete. It's incredible.
Oh, 240.
Yeah. This massive increase is primarily driven by the heart beating faster and, to a lesser extent, pumping more blood with each beat. It's essentially the horse's fight-or-flight system kicking in, the sympathetic nervous system.
So then it sounds a bit counterintuitive, but some things that look like abnormalities on an ECG are actually perfectly normal sometimes. Can you help us understand that critical distinction?
That's a crucial point, absolutely. For example, something called a second-degree atrioventricular block. It sounds serious, but it's quite common when a horse is just standing around totally at rest. But what makes it physiological or normal is that it should resolve or at least significantly decrease with even mild exercise, like just walking. If it persists or worsens with exercise, then it becomes a red flag.
Okay, so that's the key difference.
Exactly. Now, what makes an EAA pathological or truly problematic? Several factors can lower the heart's arrhythmogenic threshold, which is basically its tipping point, or it becomes vulnerable to developing arrhythmia. This can include things like an overactive stress response from the body, the heart muscle actually stretching because of the increased blood flow, and critically, electrolyte imbalances, things like potassium, calcium, magnesium, which can be, severely depleted by sweating and dehydration during hard exercise.
Right, those electrolytes are so important.
They really are. We also look at underlying structural heart disease, like issues with the valves or inflammation of the heart muscle called myocarditis, and even a suspected genetic predisposition in certain breeds.
So if you're a horse owner or rider, what tangible signs might you actually see that would make you think, this could be an EAA?
Often, the very first sign an owner notices is simply poor performance. That vague feeling that the horse just doesn't feel right.
Yeah, that phrase comes up a lot.
It does. Perhaps slowing down unexpectedly or tiring out way too quickly during work. This can escalate to a horse that just can't tolerate exercise, maybe starts stumbling, becomes uncoordinated, which could be due to reduced blood flow to the brain, or just shows general weakness. The most concerning signs, though, are collapse or syncope. That's a loss of consciousness during or immediately after exercise. Syncope is a critical indicator of a very serious underlying arrhythmia.
That must be terrifying to witness.
It really is. Less common signs might include labored breathing that isn't obviously due to a respiratory issue, or even the owner actually feeling the horse's heart palpitate, like flutter against the chest wall. And very rarely, it can lead to sudden death.
It's truly a puzzle, isn't it? Because you mentioned many of these horses can present with completely normal findings on a standard physical exam at rest. So how do you even begin to uncover these hidden heart issues?
This is precisely where the specialized diagnostics become indispensable. A resting electrocardiogram, or ECG, It's great for getting a baseline rhythm, but it very often fails to detect those arrhythmias that only show up when the horse is working hard.
Right. So it misses the trigger, which means the gold standard, as they say, is exercise electrocardiography, sometimes called telemetry.
Exactly. That's the one. This is where you need specialized equipment and usually a controlled environment, like a high-speed treadmill or sometimes out on a track. The horse is exercised at progressively increasing intensities while we continuously monitor its heart rate, rhythm, and of course watch its clinical signs very closely. It's absolutely vital to make sure those ECG readings line up with what you're actually seeing the horse do during exercise. You correlate the two.
And it's really interesting to see technology like smartphone ECG devices coming into play now. They sound like they could be useful, maybe for a quick check after exercise.
Yeah, they can be a great preliminary tool. They might help identify individuals that need, the full, more extensive studies.
Hmm.
Beyond that, an ambulatory or Holter ECG can be incredibly valuable too.
That's the 24-hour one.
Right. This device records the heart's electrical activity for 24 hours while the horse is just, in its normal environment, its stall or pasture. This allows us to capture those intermittent arrhythmias that might not show up during a single short exercise test.
And a key piece of the puzzle you also mentioned is echocardiography, which is essentially an ultrasound of the heart, looking for structural problems.
Absolutely. This lets us look for any underlying structural heart disease, things like abnormal chamber sizes, wall thickness, issues with the heart valves, or problems with the heart muscle's actual function. Structural issues can definitely predispose a horse to arrhythmias. Blood work is also vital.
Yeah.
We check electrolytes, sodium, potassium, chloride, calcium, magnesium to spot those imbalances we talked about. And specific cardiac biomarkers like troponin. They can tell us if there's been any damage to the heart muscle itself. We might also check inflammatory markers if we suspect inflammation, like myocarditis.
It's a good reminder that not everything points to the heart right away. These signs, poor performance, stumbling, they can sometimes overlap with conditions like upper airway disorders or even subtle lameness, so that thorough diagnostic workup is just crucial.
It really is. You have to rule things out. Now, getting into the types, the most common performance-limiting arrhythmia we encounter is atrial fibrillation, or AF. It's characterized by an irregular rhythm, meaning the beats are completely chaotic, no pattern, and an absence of what we call P waves on the ECG, which show the atria, the top chambers of the heart, contracting properly. It can be exercise-induced, just pop up during work, or it can be intermittent, coming and going, or even persistent. They're all the time.
What often surprises owners, I think, is that despite how serious atrial fibrillation sounds, it often has one of the better prognoses for a full return to performance if you catch it and treat it effectively. So with that in mind, what does treatment typically look like for AF?
That's a great point, and it's important for owners to hear. The primary goal is always to convert the horse back to a normal sinus rhythm, getting that regular heartbeat back, what we call NSR. The main drug of choice here, historically and still often, is quinidine sulfate. It can be given orally or intravenously. Now, it does have potential side effects, things like nasal swelling, sometimes diarrhea, or even rarely laminitis, so horses receiving it need very close monitoring. It's not without risks.
Right. And then there's a more advanced option, transvenous electrical cardioversion, or TVE. Sounds intense.
It is a more involved procedure, yes. This is where we deliver controlled electrical shocks through catheters placed in the heart to essentially reset the heart's rhythm. It has remarkably high success rates, often around 90%, and generally fewer systemic side effects than quinidine. But the big thing is it requires the horse to be under general anesthesia.
Okay, so pros and cons to both.
Definitely. For those rare cases of persistent AF that just won't convert with quinidine or TVSE, there are drugs like digoxin or diltiazem. They don't fix the AF, but they can help by controlling the ventricular rate, basically slowing down how fast the bottom chambers beat, which can improve the horse's comfort and sometimes performance, even if they stay in AF. But the really good news is that if AF is successfully converted back to NSR, something like 80–90% of horses can return to their previous level of performance.
So that's pretty encouraging.
It is. Now, in contrast, let's talk about ventricular arrhythmias, things like ventricular premature complexes, or VPCs, and the more serious ventricular tachycardia, VT. These are generally far more concerning than AF. Why? Because they often signal underlying myocardial disease, meaning an issue with the heart muscle itself, maybe inflammation or damage, or a severe electrolyte imbalance. They carry a much higher risk of fainting, syncope, or even sudden death.
That's a truly sobering thought. Much higher risk. So if they're that serious, what's the absolute first line of defense? What's the immediate priority when you diagnose those?
With ventricular arrhythmias, the absolute first step is crucial. You must rigorously investigate and treat any underlying causes you can identify. That means looking hard for myocarditis, fixing those critical electrolyte imbalances, ruling out other systemic diseases. If the heart appears structurally normal on ultrasound, but you still have significant VAs happening, then we turn to antiarrhythmic drugs. Lidocaine, given intravenously, is often used for acute, severe episodes of VT, like in an emergency situation. Procainamide is another option. For long-term management of VAs that are difficult to control, a beta blocker like sotalol can be quite effective. It helps slow the heart rate and reduce the force of contractions, making the heart less irritable. Magnesium sulfate infusions can also be very helpful, especially if we suspect low magnesium is contributing. And crucially, exercise restriction is highly recommended until these VAs are well under control. You just can't risk triggering a severe event.
And it really underscores why early diagnosis isn't just about the horse's performance or health, but also very much about rider safety. You mentioned the collapse risk.
Absolutely. The potential risk to a rider if a horse with significant VAs collapses during exercise is very real. So the prognosis here, compared to AF, is far more guarded. It really depends on the underlying cause and response to treatment.
Are there other types we should briefly mention?
Sure. Other arrhythmias exist, of course. Supraventricular tachycardia, or SVT, is less common but can certainly limit performance. It might be treated with drugs like adenosine in some cases. And for very severe conduction disturbances, like a complete heart block, where the electrical signals between the top and bottom chambers are completely disrupted, well, pacemaker implantation is actually the definitive treatment in horses, just like in people.
Wow, cardiac pacemakers in horses.
Yes, it's quite specialized but possible.
So, beyond these specific drugs and procedures, what are the overarching general considerations that are paramount for managing all these conditions? Kind of the basics that always apply.
Yeah, good question. Correcting any electrolyte imbalances is absolutely non-negotiable. It's often the simplest potential fix with potentially the biggest impact. You always check and address those first. We also screen for and treat any underlying inflammation or infection anywhere in the body that could be affecting the heart. Ensuring the horse has balanced nutrition is key. And then, when it's time to return to work after successful treatment, it's always a slow, gradual, progressive process. No jumping right back in. And repeat exercise ECGs are essential. They monitor for any recurrence and really guide that safe return to activity.
It's fascinating how the body can sometimes sort itself out, too. I read in the sources that some EAAs, particularly maybe just a few odd beats that happen only during warm-up or right after exercise, they might not require any treatment at all, especially if there are only, say, 1 or 2 premature beats during strenuous work.
That's true. Not every blip on the ECG needs intervention. If they're very infrequent, not associated with clinical signs, and the heart structure is normal, we might just monitor. But if there's evidence of actual heart muscle pathology, inflammation, or damage, then rest is key, often combined with corticosteroids to reduce inflammation. The sources suggest about a 40% chance of full resolution in those cases, which isn't bad, but it's not guaranteed.
So after all this diagnosis and treatment, what's the big picture for the horse's future performance and overall health? What does the prognosis generally look like?
Well, as you can probably guess by now, prognosis is incredibly variable. It really hinges on the specific type of arrhythmia, how severe it is, and crucially, whether there's underlying structural heart disease. The very best prognosis, as we said, is usually for that exercise-induced atrial fibrillation that successfully converts back to a normal sinus rhythm. Many of those horses go back to full work. It's much more guarded, more uncertain for horses with those complex ventricular arrhythmias or those with significant underlying heart disease found on ultrasound. And unfortunately for horses with recurrent syncope, the fainting episodes, or those who just don't respond well to treatment, the prognosis can be poor, sometimes meaning retirement from athletic pursuits.
And what seems absolutely critical for success, threading through all of this, is the emphasis on ongoing monitoring. It truly sounds like it has to be a team effort.
It absolutely is a partnership between the veterinary team, the owner, the rider, the trainer, everyone involved with the horse. Repeat exercise ECGs are crucial to assess how well the treatment is working or if the arrhythmia is recurring, and to safely guide the horse's return to performance. We typically schedule these at increasing intervals, maybe 1 month, then 3 months, then 6 months, post-treatment, for example. Or, of course, immediately if any clinical signs reappear. Periodic echocardiograms, follow-up blood work, and especially careful, astute clinical observation by the Owner or rider noticing those subtle changes are all vital for catching any signs of recurrence early.
What an incredible deep dive into such a complex and, frankly, critical area of equine health. We've really seen how sophisticated diagnostic tools like the exercise ECG are just indispensable. You often can't find these issues without them. And how even a common issue like atrial fibrillation can have a surprisingly good prognosis with the right treatment plan. And why a thorough understanding of each specific arrhythmia type is so key to managing it effectively.
It's definitely a field where careful observation, utilizing these cutting-edge diagnostics, and developing truly tailored treatment plans make a profound difference for the horse's well-being and, their athletic career.
So, with all that we've learned about the intricate electrical system of the equine heart, the triggers, the different rhythms, and the risks involved, it really raises an important forward-looking question, doesn't it? How might the increasing integration of wearable technology thinking beyond just simple heart rate monitors, maybe more sophisticated continuous ECG or other physiological sensors, how might that further revolutionize not just diagnosis, but early detection and long-term management of these arrhythmias? Could this, potentially shift our focus even more? Moving from simply diagnosing problems after they occur towards proactively preventing them or at least catching them much earlier in the athletic horse, maybe even predicting which horses are at higher risk before they show clinical signs. Lots to think about there. Thanks for diving deep with us today. We really hope you feel much more well-informed about this important topic.